Hi, I'm Rebecca Cooper-Knowles, and I'm the Vice President of Operations for Intermountain Medical Group, and I'm also the Chief Nursing Officer for Community-Based Care. And I'd like to introduce my colleague here, Dr. Wallen.
Thanks, Rebecca. I'm Dr. Wallen. I'm the Urgent Care Medical Director for Intermountain Healthcare and the Medical Group.
We're looking forward to sharing more about our curbside and community testing, but we'd also like to make sure that you can ask questions. We're not taking questions by audio today, but we will be taking questions by chat. So please feel free to chat your questions over to us, and we'll make sure that they get answered. Thanks so much. We're excited to share with you about the work that Intermountain has been taking on since about March 16th to launch and build the largest within our state integrated testing site for COVID-19. And to this day, we've tested over 10,000 people for COVID-19. We have curbside and drive-through testing at 20 different locations across the state, and we've partnered with the governor's office through the Utah Coronavirus Task Force to make sure that we can provide testing sites that are close and convenient to people's homes so that people can try to stay safe and stay at home as much as possible. Some of the questions that people have asked us are, do I need to have a doctor's order to come to this site? And we do have testing options for people with physician's orders, and we also have testing available for people who don't have a doctor's order or maybe haven't spoken to a clinician. We have some recommendations for people who are experiencing mild symptoms. And if you have a mild symptom, we would actually recommend that you use the intermountain.org website and use our symptom checker that can walk people through the symptoms they're experiencing and what their next steps might be. For those who are having more moderate symptoms and they're concerned, they can use a symptom checker if they'd like, or they can just go right ahead to drive through one of our testing sites where they can be assessed with the screening questions and also tested if that's indicated. Our testing is performed by nurses and medical professionals who are skilled and ready to take care of anybody who presents. We've had a number of people ask questions about what happens if I don't have insurance or I can't pay for that type of testing. And we want to make sure everyone knows that with the passing of the Families First Coronavirus Response Act, everyone is covered for COVID-19 testing and the related exam costs. So regardless of your insurance, co-pays, other deductibles are waived for this type of testing, and that should never delay anyone from seeking care. We're here to care for you, and our testing sites are available for all. Dr. Wallen, would you like to talk to us a little bit about how it feels and what it's like to actually go through one of the testing site processes?
Yes, thanks, Rebecca. When you arrive at a testing site, usually you will be evaluated in your car, be asked some questions, and then some vital information will be taken, and then a nurse or a medical assistant will see you and obtain a swab. This is not a comfortable experience, but it's necessary to get the right sample so that we can send it to our lab, which is here in Murray, to be processed. That usually takes a few days to process and get the results back. It is uncomfortable, but it's worth it, and the MAs are trained to do this quickly and as painlessly as they can. It's very important that we have this testing done for our state, and the reason is it's one of our two mechanisms to combat the COVID-19 pandemic, the other being social distancing. So very important that people get out and get tested. Mainly what we're looking for right now is people that have symptoms. When you have symptoms, the best thing to do, as Rebecca described, is to call the COVID hotline and get screened so that the process is seamless and you can then go to a curbside testing site to have that testing done. The testing helps us greatly to identify hotspots in our community so the epidemiologists at the state level and at the local level can respond to those hotspots and flatten the curve where we can.
Thanks.
The other thing to mention is that the screening is done in such a way so that people can be socially distanced and that they're not mixing with other people that may have COVID-19 as well. So we are going to have a demonstration of this in a few minutes by Stacy and Kyle to show you what the process is for swabbing. I think first we'll answer some questions, right, Rebecca?
That sounds good. I wanted to make sure that people did know the COVID-19 hotline phone number, which is 844-442-5224. And that number is available 24 hours a day, 7 days a week, every day of the year. Looks like we don't have too many questions at this point, so it might work well to just go ahead and move to the example of our swab. And this is a real life situation, and this individual will be being swabbed the way we do it at all of our testing sites.
All right,
Stacy.
Stacy and Kyle.
All right, take a deep breath in and exhale. All right, other side, deep breath in and out. Very good. All right, did great. Oh. A bit more biohazard bag. Sit down.
Thanks so much, Stacy and Kyle. That's what testing looks like. If you've noticed, Stacy was wearing the appropriate protective equipment. She was wearing a PAPR, which is a face shield with a hood that has some pressure to make sure that the air that she's breathing is safe and keeps all of her airways safe, so that if there was a cough or droplets that came from Kyle's mouth or nose, that Stacy would be protected from those. All of our caregivers are provided with the personal protective equipment they need to stay safe, and that's an important information for anyone who comes to our testing sites, is that all of our caregivers will be in that PPE, and that's nothing to be alarmed about. That's just to make sure that they stay safe. I don't think we have any other questions right now. Oh, we did have a question about how is the PPE situation and do we have enough? Dr. Wallen, would you like to address that?
Yeah, so we're in a good position here at Intermountain with PPE, but we follow this not daily. We follow it more than 2-3 times a day to see what our PPE burn is. And that includes not just PPE, but also the number of swabs we have and other pieces of equipment. We also watch, as you noticed, Stacy had a PAPR on. That PAPR looks like a spacesuit over her head. Those PAPRs, we monitor the amount of hoods that we have, and we can do things like repair those hoods, etc. And so far, we're in a good place. We do need to be very careful of this. As you've seen in other places around the country, you can run out of PPE very quickly. So that's why we watch it very closely.
Mm-hmm. Thanks, Dr. Wallen. PPE is an important topic, and we know that it really matters to our caregivers, it matters to us, and it matters to our communities that our healthcare workers stay safe. And we're fortunate at Intermountain, we're currently doing well with our PPE supply. But as Dr. Wallen shared, we have to take careful accounting of that every day. And the amount of PPE we have is also impacted by the amount that we use it. And as more people become ill with the COVID-19 virus, the more of the supplies we will use. Looks like we have some additional questions.
One question that came in is, can you just kind of walk through the process? Do we want people calling in first, going to online? What's the process for these testing sites throughout the state?
That's great. Dr. Lone, do you want to take that one?
Yeah, I'll take that. Yeah, the preferred way of doing this is to actually call our COVID hotline. We have nurses, many nurses, answering those calls, and they screen you based on your symptoms and quite a few other questions and determine whether testing should occur. If they decide that testing should occur, then they can send an order in to our testing sites so that you can be ready for that test when you pull up. And what you do when you pull up is you call the clinic. They have a number posted on their signage. You call them and let them know you're there, and then they can come out to the car and proceed through the process that I described.
Thanks, Dr. Wallen. For anyone that is concerned about making a call to the hotline, the folks there are really excellent. They do their job really well, and they're happy to help you. But if you can't make that call and you just need to drive through or drive up to the site, that's okay too. We can help people who do that as well. We had some questions, Dr. Wallen, I think this might be a good one for you, about maternity wards and what happens to patients who maybe are test positive, and what are some of the processes we're using to keep our patients and our newborn babies safe?
Yeah, so somebody that's positive, just like any patient in the hospital, there'll still be precautions where the caregivers are placed in the correct PPE for the proper procedures that might be done. The one thing you might see that's a little different than others is visitors, and that gets to be an issue because having too many people being exposed to that person isn't a good thing. So a visitor might not be able to visit like they normally would in a maternity situation. Otherwise, the staff at the hospital will do the same PPE procedures that they normally would.
Thanks, Dr. Wallen. There's another question about, will supplies be sent to other hotspots in the country to help out some of the dire situations that we're hearing about, for instance, in, I think, New York City?
Yeah, I think that we would do that if we determined that our PPE as well as other resources are in a place that we could afford to do that. Our first job is to treat our community and then help others from there.
Yeah, I will say that we do have some physicians who have volunteered to go and serve in some of those hot spot areas, and we're excited that they are able to lend their support to the folks who are in the middle of this very difficult situation. There was another question about the swab test that we just saw, and is that a new procedure, or is this the way that we've been doing it for a while? Dr. Wallen?
Yeah, it's very similar to what we do with nasopharyngeal swabs when we test for flu. And so the difference might be we don't have a rapid test. A lot of times nowadays we have, at Intermountain, we have a rapid flu PCR, or molecular test that we can do. It's rapid in that it takes about 30 minutes. Right now we don't have that with the COVID-19 test, so we have to send it to the lab. That might be the big difference. But the nasopharyngeal swab itself is about the same as what we've been doing for a long time for flu and some other things like pertussis.
Thanks, Dr. Wallen. And we know that people are anxious to get their results back when they have had a COVID-19 test. And on average, we are seeing that takes just a few days. We do prioritize the testing by the folks who are at highest risk. For instance, those people who are in our intensive care units and those who are under significant medical duress. So those folks will be prioritized for testing, and everyone else comes after the individuals who are most impacted. But most people are getting test results within just a few days. Let's see, we've had questions about the cost of the test, and wonder if we could clarify that. At the beginning of the conference, we said we don't want anyone to go without, but what does that mean for people who want the test? That's a great question. To clarify, we know that many people are worried about the cost of testing. And what people need to be aware of is the Families First Coronavirus Response Act, which was passed, which means everybody is covered for coronavirus COVID-19 testing and all of the related exam costs as well. So regardless of your insurance status, any copays or in-network requirements have been waived, and we are able to offer testing for COVID-19 for all patients and community members who need it, regardless of their ability to pay, regardless of their insurance status. So payment or worries about insurance should not stop anyone from getting tested. We welcome those folks to come to our sites so we can care for them.
And the question also asked if you want to have a test, what does that mean for those people? We really want to focus on patients that have the COVID-19 symptoms at this point because of resources available, and that helps us identify the hot spots in our communities. And if we tried to test everybody that wanted it without the proper screening, we wouldn't be able to do this very long, and we wouldn't be able to find those hot spots then when we're at the peak.
Yeah, thanks, Dr. Wallen. There's some additional questions about hotspots. Have we found any hotspots?
Yeah, I can answer that. So there's 2 hotspots, really, maybe 3. The first is Summit County. That was probably the first hot spot and still is. The Wasatch County as well, where the Heber area is another hot spot. And then Salt Lake County is at least a place of focus at this point.
Yeah. There's some questions about adequate amounts of PPE in our hospitals, and do we have enough PPE, and are we making sure that our caregivers have the PPE that they need? I think we covered that a little bit earlier, and I think I would just reiterate to say that we understand and recognize the importance of personal protective equipment for all of our caregivers and frankly for all healthcare workers. It's really important that we protect the health of those who care for others while they're ill and sick, and also help to keep people well. So PPE is a huge issue and focus for us, and Intermountain is committed to getting our caregivers the right PPE at the right time. There have been different recommendations coming out from all kinds of professional organizations, as well as for the Center for Disease Control and the World Health Organization, and we take all of those recommendations into consideration when we provide PPE for our caregivers. Let's see, there's some questions about the hospitalization rate in Summit and Wasatch counties, and do we expect that rate to go down as we test more people? Dr. Wallen, do you want to take that one?
I'm not sure we'll see the hospital rate go down presently because we're on the curve going up. I can tell you that we might see an increased incidence of positive tests as we test more, but that shouldn't deter us from testing. We need to go ahead and keep testing so that we can really get a better understanding of what how many patients have this in our communities. So I wouldn't expect that hospital rate to go down presently, but our goal will be to get that down, and that's part of that social distancing.
That's right. Dr. Wallen, maybe you could speak to the percentage of people who test positive for COVID-19 in some of our hotspot locations.
Yeah, so the Summit County's probably the highest, and it's somewhere around 14-15%. The Wasatch County's more below that 10 to 12%, and then most of the rest of the state is around 5% and been holding steady when it comes to positive test rate.
There was a question that said, could we go over how we're expanding our test sites once more? Over the last couple weeks since March 16th, we have opened up 20 testing sites across the state. And those 20 community sites are available as a drive-through or a curbside testing. And it does help to call in advance to use our COVID hotline, but they also can accommodate people who just drive up, and we're able to screen and do an assessment, as well as provide testing for those who are eligible for testing at the time. I think we have covered most of our questions. So we're just going to say thank you so much for taking the time to sit with us this afternoon. We appreciate the questions and the interest, and we're excited to continue caring for the community during this very intense and very difficult time.